Hi, I'm Dr. Chester Griffiths.
And I'm Dr. Karimi.
Today we're going to discuss snoring, sleep-disordered breathing, and mild sleep apnea.
Snoring and mild sleep apnea affect a lot of our patients, and we're excited to share minimally invasive ways to improve these conditions. Snoring is a major problem in this country. It affects 1 in 4 Americans. Snoring can be as trivial as a nuisance that could cause problems in the bedroom with bedmates, and it can be as serious as obstructive sleep apnea, which can lead to stress and strain on the heart. It can lead to heart attacks, strokes, daytime tiredness, car accidents, and the list goes on. Snoring is the common denominator amongst all of these problems, and therefore it should be taken seriously.
Snoring, which is an asynchronous vibration of the soft palate, leads to a physiologic stoppage of breathing, which is called hypopnea. Obstructive sleep apnea is the complete cessation of breathing, almost like choking. Snoring is a physiologic problem, and it has to do with the anatomy of the airway. Nasal airway obstruction, either from a deviated septum, enlarged turbinates, or chronic sinus issues, will lead you to mouth breathe. When you mouth breathe, you lose the anchor of your tongue slides back into the back of your mouth, creating an obstruction, and it increases the force of breathing. So you're actually struggling breathing through your mouth during the evening.
During your consultation, we'll take the time to really assess your individual anatomy, starting with your nose and your nasal breathing, and then focusing on your palate, because the palate is the contributor to snoring and sleep apnea in 80% of patients, and even looking further down in the throat. Signs of snoring and sleep apnea may include wanting to take naps frequently, falling asleep in inappropriate situations, decreased concentration, decreased productivity, and daytime fatigue. Snoring and sleep apnea are related, but they're not necessarily the same thing, and that's why it's important to have the proper assessment and the consultation and evaluation to be able to determine how significant the snoring is or how major the sleep apnea is. The good news is that there are new, innovative, minimally invasive ways to improve snoring and mild sleep apnea.
The treatment of snoring and sleep apnea is in a staircase-like fashion, starting at the most minimally invasive procedures up to very extensive surgical procedures. We believe that if you're within 10% of your ideal body weight, then minimally invasive procedures to improve your nasal breathing and to stiffen the soft palate to prevent the asynchronous vibration of the palate, also known as snoring, can be achieved with the pillar procedure.
The pillar implant is a series of polyester implants that are inserted directly into the soft palate, which is the part in the back of the mouth and throat that vibrates and leads to snoring and can also contribute to mild sleep apnea. With local anesthetic, the pillar implants can be placed in a 10-minute office-based procedure.
Over time, scar tissue grows into the pillar implants, thus creating a plate-like stiffening, preventing the asynchronous vibration of the soft palate.
This implant has helped hundreds and thousands of Americans overcome mild snoring and mild sleep apnea. The pillar procedure is very well tolerated. Local anesthetic is placed in the mouth, so very oftentimes very little is felt during the procedure, and the recovery is also very fast. The procedure itself has a very low, less than 1% complication rate. Complications can range from an infection, which is extremely rare, to one of the implants being partially extruded or coming out, which can also be taken care of very easily in the office should it happen, although that is very rare.
We hope this presentation has offered some understanding of sleep apnea and snoring.
1 in 4 Americans suffers from snoring or mild sleep apnea. Don't let this continue to be a problem in your life. Please contact us at Pacific Specialists.
We are here to answer any of your questions.